How is LDL cholesterol measured in a blood test? Have you ever wondered how your doctor measures low-density lipoprotein cholesterol during a blood test? Understanding this process can help you take charge of your health. Let's break it down. Low-density lipoprotein cholesterol is typically measured through a blood test known as a lipid panel. This panel also looks at total cholesterol, high-density lipoprotein cholesterol, and triglycerides. To start, a healthcare professional will draw a blood sample from a vein, usually in your arm. This sample is then sent to a laboratory for analysis, where the LDL cholesterol level is reported in milligrams per deciliter. There are two main ways to measure LDL cholesterol. The first method is called calculated LDL cholesterol. In most cases, doctors do not measure LDL directly. Instead, they use a formula that involves total cholesterol, high-density lipoprotein cholesterol, and triglyceride levels. This calculation is often done using the Friedewald equation. It subtracts high-density lipoprotein cholesterol and a portion of triglycerides from total cholesterol. For this method to be accurate, fasting 8 to 12 hours before the test is usually recommended. The second method is direct LDL cholesterol measurement. Some laboratories perform this test without calculation. They use specific assays that isolate LDL particles and measure the cholesterol content directly. This method can be particularly helpful when triglyceride levels are high, which may affect the accuracy of the calculated LDL cholesterol. In addition to these standard measurements, there are advanced tests that can provide more detailed information. These tests measure LDL particle number and size using techniques like nuclear magnetic resonance spectroscopy. Smaller, denser LDL particles are more closely linked to plaque buildup in arteries, which can increase the risk of heart disease. In the laboratory, automated chemistry analyzers detect cholesterol by measuring color changes caused by chemical reactions with cholesterol in the blood sample. They assess both free cholesterol and cholesterol esters, giving a complete picture of LDL cholesterol levels. Measuring LDL cholesterol is essential for managing hyperlipidemia and cholesterol levels. Elevated LDL cholesterol is often referred to as bad cholesterol because it contributes to plaque formation in arteries. This can increase the risk of heart disease and stroke. By accurately measuring LDL cholesterol, healthcare providers can assess cardiovascular risk and make informed treatment decisions, which may include lifestyle changes or medications to lower cholesterol. Before your blood test, remember that fasting 8 to 12 hours can improve accuracy, especially for triglyceride levels. The blood draw itself is usually quick and causes minimal discomfort. The results will help you and your healthcare provider monitor and manage your cholesterol effectively.